Oh,
Real good doctor.
okay, cool. Got everything out that they were hoping to get out?
Yep, well, as much as they could
As much
get.
as they could get, correct?
And
Cool.
it was fast.
Okay, well that's always
He
nice.
was good.
Okay, now I'll ask you and our friends around us, what kind of deficits are we having as far as kind of daily function, hand function, upper body function?
It's improving, I would say, every day.
Okay,
And that probably started improving after the surgery, the
Right
next
after.
day or
Yeah.
so.
okay,
Well, after that, we did the steroids. After the steroids, the tumor was sitting on top of his motor
Right.
band.
frontal temporal lobe.
Yes, and so he's been on steroids for a couple weeks,
Yeah.
and so when the tumor was affecting his left side.
Okay,
So and he's still having issues with your left
With
side.
my left
He
hand.
kind
okay,
of
so it's mostly left hand oriented.
And
left
leg,
and foot.
leg.
Okay,
Yeah.
okay,
Both of those.
And so he's as long as as long as you tell your hand you've got your pinochle cards in it, you're okay. But if he stops thinking about it for a minute, all of a sudden people say your cards are on the floor.
right.
Yeah.
So you can tell him those stories, Dad. I don't want to take it all.
No, that, or if she fixes me toast,
Mm-hmm.
pick it up and I think I have it in my hand. I
Right.
bring it over here to eat. She says, your toast on the floor.
Right. Okay, got it. Now, before the surgery and everything like that, how long were these kind of deficits kind of going on?
For,
Probably 3 months.
he's been at,
So,
he's 3 months.
We need to start back and let him know about when we started almost 2 years, what was it, a year and a half ago, and you had the Guillain-Barré.
Yeah.
Oh, okay.
hmm I was in Eugene for 3 weeks.
3 or 4 weeks
Yeah.
after they did your blood transfusion cleansing.
Yeah.
Then you went to physical
Let's
therapy.
say probably had some therapy for a while after that.
Him and Mom stayed up there for 3 or 4 weeks.
Okay.
And then he came home and everything was fine. Well, fine.
Did
We
I
had
go to therapy here though?
no.
Yeah, he
Oh,
went
you
to
did?
John-
You did? Yeah.
John Brewer,
John
yeah.
Brewer.
In
Mhm.
Coos Bay here?
John Brewer,
Or whichever one.
Yeah, in Coos Bay.
Yeah.
Right down here.
Across from the hospital.
Yeah, right, Dad. That's right.
Okay, so you're
See, I'm
in
remembering more.
You're doing really well.
Eugene for 3 to 4 weeks for the Guillain-Barré. And
that was
then,
last year.
okay, and that was last year.
January.
And then he started having a few seizures.
Okay. And then went to the doctor again.
Right, he's still on anti-seizure meds.
Okay.
And really, I think what helped the most is
He gets very emotional.
Okay, that's fine.
Fine.
Get all emotional you want. That's fine with me. I love it. You know what? Let me get you a tissue or two.
He gets very emotional.
I don't have any on the cart. Do you want some water too while I'm at it?
Yeah, that'd be nice for him.
Sure. Tap water okay?
Mhm.
Yeah. Sure.
That's okay.
I know, Dad, but it's okay. It's fine. It's fine.
It's not all just you. It's
No.
your medicine and everything else.
But
It's
you're-
okay.
It's
okay.
just that you're really happy to be here. So you're just expressing joy, and it's fine.
we just start talking about it.
That's right. And you're just happy to be here. Yeah, you're doing really, really well. This is really good.
It is.
I'm happy you're here to cry. Because if you weren't crying, then I'd probably be crying you weren't here. So I'm happy you're here.
Oh, crying's good stuff. It's cathartic.
Is it?
Yeah, of course it is.
I always expect her to do, because when I first got married, she always clobbered me.
Right. Now, Dad's a kidder, so all the time if he tells you that Mom hit him, he is kidding. I don't want you to report that.
Yeah, right.
If he comes
Patient
in,
reports abuse and lawsuits are coming up. I'm getting phone calls from people I don't know.
yeah.
Now I forgot what I was going to say.
Does that seem to happen a lot?
Oh, he's getting better. I tell you, he's really going back, and for some reason
In time.
you are for some reason ever since he's been taking the steroids, he's been pulling memories just from
Yes.
kid. Oh yeah, really, it's really good.
Okay.
Yes, very good.
Because during the night
Okay.
when I woke up, I told her, you know where I was at? clear back on the farm in Nebraska in 1936, 37.
Yeah.
Is that where you grew up?
Yeah.
Did you grow up in Nebraska?
I grew up in about 6, 7 years. But I remember that. I thought of it during the night. My 2 brothers and I would get on the horse to go to school.
Oh, look at that. Not bad.
Yeah.
Not bad.
What did I tell you this morning?
A lot. You talk a lot there.
Okay. Let's stay on track. Stay on track. Are you right-handed or
Oh, I forgot
left-handed?
about being here and you treating me.
Yeah.
No, that's
Just how
okay.
you're
No,
having
we're just
fun.
hanging out.
Yeah.
Right-handed or left-handed?
I'm right-handed.
Okay. Got it. What's the Caesar medication he's on? Do you know?
It starts with a C. Clarion or something like that.
No.
I'm not for sure. I should have wrote that down. I meant to get it.
I'm
It's
sorry.
okay. You could bring in his med list next time if you
Okay,
have.
I
Just
will.
because I like to know what people are on.
Just Prilosec, then
Okay.
and that, and
Okay.
then the steroids that they're giving us now.
Yep.
That's
Got it.
all. Just those 3.
Cool. Got it. Make a full fist. Okay. Now roll up to what we call a hook fist. That looks beautiful. How about if you open your fingers all the way? Good. Squeeze my hand as hard as you can. Good.
That's my left hand, so it's not
That's
very
okay.
Oh!
It's okay. It's fine. Good.
You popped some bones on that one, Dad.
You just have to go to the doctor.
Good thing he's at a clinic.
Now, before surgery and everything, was his hand not moving well? Just wasn't using it a lot? What was
Yeah.
kind of this?
I would put him in the truck, for example, and his left hand would be behind him,
Okay.
and he wouldn't know it.
Wouldn't know. Okay.
Yeah.
His left foot he would drag.
Okay.
So
Gotcha. And that seems, since the removal, to have gotten better some?
much.
Even, because that's only, obviously only a few days ago, but.
Right. It's been
Yeah.
amazing.
Okay.
Because
okay,
you
cool.
dropped something, you don't even know you dropped it.
That's right. You went from needing help to do almost everything to where he's getting into my truck and getting out and
Okay, and using the hand.
using the
door,
handles, pulls
handles.
himself up.
Cool.
Yeah, very
Cool.
good. Yeah.
Cool. But still noticing some of that as far as the
He's
toes,
just having mostly his
cards.
walking problem.
Mostly his walking problem. Okay, cool. But the upper extremity seems to have.
Except for his one arm.
He just has to.
Which one are-
He just has to tell his hand, you're doing this. And
Yeah.
if he doesn't keep, and they said that when we were up there, the nurse said, or the physical therapist said that you're going to have to keep telling that hand
Right.
what you're doing, you're retraining kind of.
Right. In the therapy world, we call that mental imagery. You have to imagine it happening. Sometimes I tell people that they don't even need to do something; they just need to think about it sometimes.
Oh.
Because the more you think, the more you send a signal,
Yeah.
the more things talk.
Yeah.
And then the more they talk, the more they do things naturally. Especially because now you have that thing taken out of your brain, so we'll go ahead and say you have more space now.
But he said, I got a lot of space up there.
I'm sure they said you had a bunch of. Was it empty space? Did they say empty space?
Yeah.
I'm playing with you.
But I got it. They said I think from here down, that's where that feeling started going away.
Okay.
In my head,
Okay. Were you awake for the surgery?
No.
No. Okay.
and I've noticed that for quite a while. It'd work up my side.
Right,
up
and the
here,
whole left
then
side
from
would feel
here
fu-
over is okay.
Uh huh. But there down, it'd be funny.
But over here, it didn't seem right. I
Right.
had that much.
Right. Well, the brain works opposite for the body. So
That's,
Yeah.
wherever, yeah.
So it would have been over here then.
Right. So it's that part of your brain affecting that part of your body.
Oh.
Right. It's opposite. Yeah, because the spinal tracts they cross.
Oh.
Yep. Well, some stay on the same side, but in your case, we're worried about things that have crossed.
So I don't have to have this part taken out.
Your dad, he doesn't know you're joking all the time. So.
Hey, can you come on your elbows, please? Can you get your elbows right on the table?
Oh.
Your elbows.
There you go.
Yep, just like that. Perfect. Now drop your hands all the way, wrists all the way back. Good. All the way back, as far as you can go.
Oh.
No. Watch me. We're gonna go like that.
Go for it.
Okay, beautiful. Good. Now drop them all the way down. Okay. Do you have any pain or anything with that?
Mm-mm.
That feels pretty fine, right? Okay.
That's great.
Okay. I want you to take your thumb and go to each fingertip one at a time. Beautiful. And now go from your pinky to your index finger.
The pinky,
Go from your thumb to your pinky and then touch it to each fingertip to your index
I
finger.
don't have fingernail polish on.
Well, we don't have to, we'll put that on later, I think.
Okay, now go back the other way.
Yes. Make sure you're touching the tips of your fingers.
Oops.
Good. Now go back the other way, please. Beautiful. You scored 150%.
Good, great.
He's gonna say that.
That's because she helps me a lot. So you give her the credit.
Okay, perfect.
Okay.
I'll give her the credit for that. I'll write credit to the wife. Good. Got it. Signed off. Okay, now bend your thumb over as far as you can
This one?
in your palm. Both of them, please.
Both.
Hmm? Beautiful. We don't need to curl your fingers too.
Oh.
Just the thumb. Hmm? Good. You have a little knot spot there?
Yeah.
Mm-hmm.
You put a screwdriver through there.
Put a screwdriver, huh?
I think the screwdriver.
You have
Is it
to-
still in there?
No, I think they went through this hand.
No, it's the other one, honey.
It's hereditary.
That was years ago.
Yeah. Dupuytren's?
I
You
don't
ever heard
know.
that?
Nope.
Tightening of the fascia in the palm. It's called Dupuytren's disease. Yeah. But I'm not a doctor, so I couldn't diagnose that. But in case you ever want to,
Okay,
in case
I'll
your
look-
finger ever starts drooping more than 20 degrees,
That's what it is.
we'll see what the doctor says.
Okay, all right.
Okay. I'm going to test your grip strength to start.
It's what now?
I'm going to test your grip strength.
Oh,
Okay, so we're going to put your elbow to your side. You're going to squeeze this thing as hard as you can.
like this?
Yeah, watch the dial. See how the dial goes up?
Okay.
Yeah, so it's not going to feel like you're doing much, but you're going to hold as hard as you can.
Oh,
So we'll do right hand first, just like that, and squeeze as hard as you comfortably can. Good. How many pounds do you think you could squeeze? Take a guess.
I'd say at least 10.
70. Good job.
70.
You missed it just a little bit, honey.
Okay, now the left one, please. Right? Elbow into your side. Good.
Squeeze.
Squeeze as hard as you can. Great job. Good. Did the doctor put you on any kind of restrictions?
10 pounds.
10 pounds of lifting?
Yeah.
Yeah.
No lifting more than 10 pounds.
And no bending over.
Okay,
Yeah.
that's what I figured.
Yeah.
10 pounds lifting,
No bending. Or very little bending.
Mm-hmm.
bending at the knees.
Yeah.
He likes
But a
to
lot-
pick up everything. I don't.
Well, you're so used to doing things as habits.
Well, right, but you're not very used to having brain surgery, so we have to be very careful here.
That's right.
It's strange how you're so used to doing things, and then try to break that habit.
Yeah.
Okay, so 10 pounds, no bending forward. Any others?
That was it.
Okay.
Said he could still do dishes.
Yeah.
Yeah, well, as long as your sink's tall, which most of them are, you probably do dishes.
But I don't like to have dishwater hands.
Yeah.
Well, these are the days of our lives, aren't they? Okay, does his hand, upper extremity seem to swell at all?
No, it did before we went. It was swollen.
That's
Okay,
right.
okay, so swelling prior.
Not now, though.
Okay.